Two, 1, 2. Level. Later. Sharp. 2, 1, 2. Later. You grind.
welcome the Honorable Premier, President Premier Peter Zigalala, who today is joined by the Honorable MSc for Economic Development, Tourism and Environmental Affairs, MSc Rapipile, as well as the MSc for Health, MSc Melanie Zulu. This briefing takes place shortly after the announcement of the country having entered into a second wave, so we're receiving this update about the province. Without any further delay, I'm going to be handing over to the Honorable Premier to take us through the statement for today, and then we'll take the questions of clarity thereafter, and the colleagues that are following us online will also be forwarding their own questions either to myself or to my colleagues. Hi, thank you. So without any further delay, we hand over to the Honorable Premier.
Thank you, Mr. Mabaso. Greetings to all of you from the media, deliberately starting with you, because you are the most important people who have helped us to also communicate and educate our people on the effect of this pandemic. Let me extend our greetings to MEC for Economic Development, Tourism and Environmental Affairs, Honorable Pillay, MEC for Health in KwaZulu-Natal, Honorable Ms. Nomagugu, Masmilane Zulu, government officials who are here led by Mr. Mabaso, of course, members of the media, compatriots, and all. We welcome you to this media briefing, which mark our first gathering since our Health Minister, Dr. Zweli Mkhize, officially announced the arrival of the second wave of COVID-19 infection on the 9th of December 2020. We wish to start by registering our shock and sadness at the passing of Umlalazi Mayor, Councillor Jege Zulu, who passed away yesterday after an illness. Councillor Zulu was a respected local government leader with unmatched work ethics and a sheer determination to change people's life for the better. He had a profound understanding of the direct and the immediate impact that local government can have on people, and made it a great priority to ensure that government serve the people, and not the other way around. We say that may his soul rest in peace, and may his family, friends, and all those who know him be comforted and find strength at this trying time. With regard to the second wave, in KwaZulu-Natal, this briefing comes in the midst of December festive holiday, which is like no other in our living memory. Traditionally, by now we would have been in full celebratory mood, ready to bond with our families, but this year's festive season feels different to what we have previously been accustomed to. The COVID-19 pandemic has changed many aspects of our life, and the important new habit we have formed must shape our behavior over the festive season. Celebrating life and protecting the lives of those around us will be a major gift that we can give to each other during this festive season. We find ourselves confronted by a resurgence of COVID-19 in our country and in the province. Indeed, the second wave that we were warned about for the past few months is here, and it is proving to be more deadly than we thought. In recent days, we have found ourselves increasingly in mourning. This is a stark reminder that COVID-19 is not on holiday. It is in fact back, and it's very, very dangerous. Many people now know at least a few people who have passed away due to COVID-19, which is a cause of major concern and a bitter pill to swallow. What this means is that we need to embrace our new normal, whereby all our actions are informed by needs to protect ourselves from acquiring and spreading COVID-19 to others. This therefore means that it is not negotiable for us to adapt and adopt new ways of doing things in order to stay safe from the virus. A few minutes ago, we concluded the road safety campaign known as Hood for Life, Arrive Alive, as well as monitoring and inspections of various areas and public amenities for compliance with COVID-19 regulations by our citizens and various establishments. This campaign, which we undertook with the Minister of Transport, Honorable Mbalula, and our MECs, has given us a first-hand impression of whether our citizens are heeding the warnings about the second wave or not. We must express our satisfaction with the level of COVID-19 compliance by many establishments and outlets. Deeply concerning, though, is the behavior of some individuals. There is a high level of non-compliance with proper wearing of masks, which seems to be influenced in most cases by alcohol consumption and a high appetite for gatherings, especially in areas of entertainment that pose a high risk of being super spreaders, including the beaches. We've also noted footages depicting scenes of overcrowding at beaches and failure to wear masks by people who are swimming who are swimming in rivers and elsewhere. We wish to remind citizens to conduct themselves responsibly. The wearing of masks is compulsory, and adhering to social distance is an absolute necessity. So is the need to respect the 11 p.m. to 4 a.m. cafe that has been put in place by the President. Those who intend or who are floating the safety regulations are being warned that we are going to take serious actions. We have resolved to intensify our monitoring efforts and get the law enforcement to effect arrest where warranted. We have intensified law enforcement. To this effect, from the 1st to the 18th of December, a total of 14,589 vehicles were stopped and inspected by our traffic officers. As a result, a total of 56 vehicles were suspended and 130 unlicensed vehicles were discovered. In terms of fatalities, since the 1st to the 19th of December, the province has recorded 130 fatalities. This is lower than the 159 fatalities recorded during the same period last year. With regard to compliance with liquor trading laws, the KwaZulu-Natal Liquor Authority, which is an entity operating under MEC Pillay in the Department of Economic Development, Tourism and Environmental Affairs, working together with SAPS as well as various municipalities, will now be increasing bleeds at various high-risk areas across the province. To date, we have undertaken a total of 44 joint law enforcement operations led by SAPS and the KZN Liquor Authorities. During this time, 24 liquor licenses were suspended, while 13 more suspensions are in a process of being finalized. The Liquor Authority has also noticed a surge in fraudulent liquor licenses and has doubled effort to clamp down on these. For an example, in the last 3 months, 12 fraudulent licenses were uncovered by the SAPS. More operations will be conducted in this regard during the festive season. The province of KwaZulu-Natal, when it comes to COVID-19 trend and analysis, the province ranks as the fourth biggest contributor countrywide in terms of laboratory confirmed cases and has observed a substantial increase in the number of new cases in the past 2 weeks. We are currently in week 51 of 2020. For week 50, the actual number of confirmed cases was 9,857, while for week 51, the number is now standing at 10,194. This marks a 4% increase of infection between week 50 and week 51. Over the past week, the highest number of cases received was 2,912, and that was on Saturday, the 1st of December, while the average number of cases recorded daily was 2,165 cases per day. In terms of the district, eThekwini district has continued to record the highest number of new cases daily and contribute approximately half of the total laboratory confirmed cases provincially. The 5 districts that are hardest hit by COVID-19 second wave in the province are as follows. It's eThekwini, which is now having 66% of new cases. It is followed by Ilembe. Ilembe has 5.5%, Umgungundlovu 4.2%, Ugu 9.9%, Hirigwala 1.7%. If you take this into numbers, it will then tell you that eThekwini, the new cases are 1,625. Ilembe, new cases is 1,033. Umgungundlovu, it's 103. Ugu, 242. And Hirigwala is 42. In terms of deaths, we are concerned at the fact that the province is experiencing an increase in the number of COVID-19 related deaths reported daily. The actual number of deaths which occurred in the week 50 was 68, and for week 51 it was 111. The average number of COVID deaths recorded daily in the past 2 weeks was 13. It tells you that we are facing a serious challenge. If on a daily basis at least 13 people will pass away because of this pandemic, and this is very, very serious. So the case fatality rate for the province was at 2.4%, while the mortality rate was at 32 deaths per 100,000 population. With regard to home deaths, the province has also experienced an increase in the number of home deaths. On the 17th of December, the province received 22 home deaths. This means that the province now has 142, or rather 3% of deaths that occur at home since the beginning of the pandemic. We send our deepest condolences to all families of the dearly departed. With regard to the positivity rate, the number of cases testing positive in the past 2 weeks increased from 15% to 24.5%. Infection among healthcare workers, a total of 7,891 healthcare workers have been infected with COVID-19 in the public sector since the beginning of the pandemic. Of the total infected, 91 sadly succumbed to this disease, and that 91 represent 1%. The majority of the infected healthcare workers were nurses, and that represent 56%, and others 56%. The number of infected healthcare workers has increased by 449, which is 6% in the past 7 days. In terms of recoveries, the overall proportion of recoveries for the province continues to decline and is at 82%. The decline is consistent with an increase in the number of new cases and the incidence risk. In terms of the strain, as per the announcement by Health Minister, Minister Zweli Mkhize, a new variant strain of COVID-19 has been discovered in the 3 provinces, including KwaZulu-Natal. The clinicians are currently undertaking more studies to establish if this new variant does change the cause of the disease. We are, however, deeply concerned at the rate of infection and the increased numbers of deaths. This calls for all of us to sit up, take note, and change how we do things. With regard to the bed capacity, the province has developed a resurgence plan for a festive holiday as well. Both of these, which is the resurgence plan and the festive plan, are based on the experiences we went through during the first wave of the COVID-19. At the cornerstone of these plans is the health education, isolation, quarantine, and contact tracing. We are focusing on encouraging fellow compatriots to wear their mask, wash their hands frequently with soap and water or alcohol-based hand sanitizer, and practice social distancing. We have suspended major events, and we are clamping down on non-compliance with regulations. We are planning to shut down and effect arrest on those organizing super spreader events. We therefore appeal to the public to avoid attending super spreader events as they have proven to increase the transmission of the virus. There is no time to fool ourselves. We are shedding enough tears already, and we will request our people and all members of the society to cooperate with us. We also want to dispel the notion that our healthcare facilities are beginning to succumb. Yes, the healthcare facilities are experiencing a high demand, but the system has not succumbed due to pressure. It is up and it is functioning. We have enough capacity. The department has prepared a total of more than 3,000 beds in public health facilities in response to the second wave. Out of these 3,000 or more beds, we have also those that are for ICU that are also prepared. We once again appeal for people to stop spreading fake news and create unnecessary public apprehension. The government will remain open and transparent with citizens at all times. With regard to the staff capacity, our efforts remain fortified by the presence of staff who were employed for the COVID-19 first wave. We are happy that their contracts have been extended so that they can assist us to respond adequately to the second wave. The province has recorded a number of cluster in the healthcare settings, church gathering, retail shops, funerals, ceremonies, and parties. And cluster infections are all over. The recent cluster outbreak in gatherings have proven to be fatal and to be very, very challenging, as it has been proven that in one of these mass gatherings that took place in Assisi, COVID, in Uku, about 6 nurses passed on. But that was also followed by the cluster outbreak of KwaSizaBantu under Umzinyathi district. We are told that about 2,000 people attended. And I wish to repeat this, more than 2,000 people attended this event. It is unthinkable, and no one can imagine such a thing happening in the current environment. It is hardly surprising that at least 48 of the attendees have already tested positive. We once again wish to issue a warning to all our fellow compatriots that we are now confronted by a dangerous outbreak of COVID-19 in KwaZulu-Natal. We appeal that everyone acts responsibly. With regard to admission and isolation, as of the 18th December 2020, a total of 717 patients were admitted for COVID-19 and 1,274 were admitted as persons under investigation in public health facilities. As of the 18th December, the private hospitals in the province had 1,506 patients admitted, with the majority being in eThekwini, and that is 1,008. The department has a total of 775 ventilators and 915 non-invasive ventilators. Some hospitals in the private sector have been under pressure in terms of bed availability, but the department has prepared enough beds. The situation is being reviewed on a daily basis, and additional beds will be made available if a need arises. The department has not activated beds in the private sector facilities for patients under investigation, but will do so if the need arises. The current turnaround time for the analysis of COVID-19 tests with the National Health Laboratory Services is now 72 hours. We continue with tracing program. The department is implementing a number of strategies in dealing with contact tracing, and such strategies include the following: the targeted screening and testing of contact in areas that are deemed hotspots, the activation of district call centers to do telephone monitoring of contact, and the activation of additional contact tracing teams. With regard to the impact on the economy, especially tourism, we expect that about a 69% decline in the domestic tourism will take place in 2020 compared to 2019. This represents about 2.3 million trips in 2020 versus the 6.2 million trips recorded in 2019. The estimate spend will be about 3.6 billion compared to 8 billion in the previous year. The tourism sector is expected to recover to 2019 levels at about 2022 or 2023. That is just a forecast. For the 2020 festive season, which is December 2020 to January 2021, we are forecasting that we will receive between 600,000 to 750,000 domestic visitors. In 2019, there were about 815,000 domestic visitors for both December and January. Following the announcement of more restrictions, including the closure of beaches and public parks on certain days, a survey was conducted on 144 accommodation establishments across the province. This was to establish the impact of the announcement on the tourism and hospitality sectors. Of those interviewed, 59% establishment reported to have received cancellation for the festive season period. In terms of occupancy, it must be reported that the occupancy rate is varying with some cancelling, and some of cancellation were due to anti-travel anxiety due to the increase of COVID-19 numbers. And the occupancy in our establishment in eThekwini, we've projected 25% reduction in occupancy rate from what was 70% to 55%. Ilembe, 20% reduction. Ugu, it's at 80%. Currently, Ugu, it's at 80%, and that is good. Umgungundlovu, the occupancy rate is between 45 to 50%. Umkhanyakude is fully booked and was not affected by beach restrictions and all of that. Zululand was sitting at 45% in terms of occupancy rate. Amajuba between 45 to 50%. Drakensberg establishments in Uthugela have reported 100% occupancy for this week until the 5th of January. So it moves us that the occupancy rate is not that bad. It has moved from 80%, but we would want to ensure that in all areas we continue to monitor the situation. In establishment like Battlefield, they are at 80%. Ezemvelo is projecting a 5% drop in their own establishment, and that will be a decline from 42% to 37%. The KwaZulu-Natal is, however, the KwaZulu-Natal government is, however, in full support of the latest restrictions as announced by the President, His Excellency President Cyril Ramaphosa, recently. We believe that these restrictions strike a healthy balance between our numbers and our priorities of saving lives, but at the same time, preserve the need to stimulate the economic activity. The Department of Economic Development, Tourism and Environmental Affairs, working with other departments such as the Department of Labor and the SAPS, have been conducting inspections at various businesses in the province. Businesses that have been inspected for compliance with COVID-19 restrictions include supermarkets, factories, gym facilities, and banks. These spot checks will be done continuously as we still continue with the implementation of restrictions. We will not hesitate to take actions against those who are found to be floating the rules. And in this regard, we are emphatic. Let us strike a balance between protection of the people and the lives and the economy. We wish to make a renewed call to the public to partner with us as government as we try our utmost to navigate our way out of this deadly second wave of COVID-19. The only way that we will make it out of this situation will be through taking personal ownership of the responsibility that we all have, which is to avoid acquiring and or transmitting the virus to others. It is individuals that transport and help the virus to travel to others. The success we have made in the first wave can easily become our failure. The worst has not passed. It is with us. But we now have more information and more knowledge about this virus than before. What we see as the challenge or a key question is whether are we disciplined enough to adhere to the warnings that will save our lives and the lives of those of our loved ones. We ask our pastors, traditional leaders, mayors, councillors, community leaders, and every citizen to play their part and prohibit activities that may be super spreaders. And we would want to cooperate, and we wish to appeal to our religious leaders, because some have taken an approach that borders on trying to say the virus is not going to be impactful. We wish to plead to all of them. Let us once again come together, cooperate, and work our way through this challenging moment. We can do it. Making a difference start with you and I. Each and every one of us must play her or his role. I thank you, Mr. Mabaso.
Thank you very much, Honourable Freeman. We move straight to political priority as the police in the House.
Thank you, Premier and the MECs. JV from the SABC. This question is directed to the Minister of Health, the second wave of COVID-19 has claimed the lives of 7 sisters and mothers of the congregation and daughters in Diocese of Port Shepstone. They all died within a week. Reportedly, 15 other nuns are also gravely ill. What support will be given to the religious sector, and is there concern as we fast approaching Christmas? Thank you.
Thank you. Hi, for Michael Lane from Eastern Africa. Premier, let me start with you. I got in a bit late, but you were talking about stats and how the recovery of the economy of KZN and how you're confident in that. Is that going to be on par with what we've seen in the past, or will you be adapting to the new normal that KZN has put, so the COVID-19 has put the whole country? So when you're talking about recovery, those terms, are you adjusting those numbers, taking cognizance of what COVID-19 has caused? And for you, MEC, for health, thank you. The health system is already very burdened. So when we have a new variant of this virus, is there any concern that bed space and also hospitalizations might increase? Because even though the government says don't panic, but are you making preparations just in case we see numbers spiking again of hospitalizations and deaths connected to this new variant? Thank you.
Thank you. No one is described. Okay, let me take over to the Honourable Freeman.
Thank you. I think it will be better if I allow MECs. Yeah, because there is a MEC for economic development and MEC for health. So they will take these questions. If there is a need to add, I will come back.
Good afternoon, ladies and gentlemen. We only have 2 questions. The first one is in relation to the sisters that were affected, and I think we need to firstly we need to pass our condolences to the families, to the church itself. The report that the Premier has read and given to us was indicating that this is as a result of a gathering that was held at that particular church. As a result, you will find that in the reporting, the report in the media are actually saying it's Merian Hill Convent, but it's actually one group, because that is how they name their districts. So it is between Merian Hill and Uku district itself. What support are we providing to the religious sector? We have been having continuous engagement with the religious sectors through the Office of the Premier. I think the last one we had about 2 months ago, and the kind of education that is needed and so forth, and we are going to continue with that. There has been requests in this particular instance from the Catholic Church to say, could they be provided with sanitizers and masks and so forth. We will be looking into that. But there's also an element that speaks to the Social Development Department, and the DSD, I think, was informed by the Office of the Premier as well to get in and see what kind of assistance they can provide. Having said that, we are calling on all the religious organizations, the churches, all the centers, to be aware that, yes, We had our peak around July, August, and we went through it, but we are now faced with a new situation. We might be on level 1 lockdown. However, the circumstances that we are faced with are pushing us to ensure that we reduce the number of people that we have, or the number of people that actually engage are in one room at any given time. When the president made an announcement last week, he indicated that in-house, we are looking at having, I think it's 100 people as a limit, but outdoor it's 250. While that is a guide that we cannot go beyond, as a Department of Health, in reality, we are calling on people to avoid gathering, because sometimes it becomes very difficult to actually separate the people from each other, particularly when we are attending church gatherings. You are singing, you sing next to each other. You know, it becomes really impossible to be practical with the protocols. It's probably not even possible to sing with your mask on. I've not tried it because I'm not very good at singing, but I think it's a bit difficult, because it's difficult for me to speak to you right now because you won't be able to hear me. So what we are calling on and requesting our religious leaders to actually be vigilant on and work on is try to reduce them numbers as much as possible. If we can avoid gatherings, let's do so. If we can have gatherings virtually, as we have started over the year, we encourage that, so that we avoid the contacts as much as possible. You will know, well, you probably don't, but in the last week or so, there was a report in the social media of 3 elderly sisters who are siblings. They go to the same church. There was a church engagement in Ladysmith, I think, and they all went there, and then they came back. All of them were infected, and all of them passed on, one after the other. 3 siblings. Can you just imagine that happening in a space of 2 weeks? Again, they had also came from a church gathering. So we are making a request, and we are making a plea that church leaders, if we could really go back to the options that we utilized during the hard lockdown of virtual engagements, I think we could be able to save this particular, we could be able to navigate this particular spread. We are going to have probably virtual engagement with the other leaders or religious leaders in the week that is starting, with the Office of the Premier, so that we are able again to thoroughly, now tangibly plan on what needs to be done, on what can be done. We know what are the requests that they have given to the Office of the Premier and the Department of Health, and we will be assisting where we are able to. In relation to the health system, is there concern about bed space, and are we prepared? At the moment, as the Department of Health in KwaZulu-Natal, we are not concerned about the bed space. We believe we have sufficient beds. The beds actually that we planned, or that we had created in June, July, we were not able to utilize all of them. So as we continue with the beds that we had created, we still are just, not even just above, we are more than above the required number of beds that it seems to be needed currently. But what we need to make an issue of, and I'm glad you asked that question, because it gives us an opportunity to make a call to the communities, is that this particular strain of the virus is unpredictable. The one that we were dealing with when we peaked around July, August, at least we had learned through the other countries how they have dealt with it and how to manage it. But this particular one seems to be a bit unpredictable, because no one really at this point is able to understand how this strain behaves. So we are calling on our communities to go to the public health facilities as soon as they get symptoms. As soon as you get symptoms, even if you had chosen to self-isolate after you got your results, it's fine. But as soon as you get symptoms, please go to a facility, because sometimes waiting for too long at home is what actually adds on the number of the mortality, on the mortality numbers that we are getting. So we are making a call that we have enough beds in the public sector, please come to our facilities even when you have decided to self-isolate. Once you get symptoms and they get a bit strong, come so that you are treated early. That becomes the best way of treating COVID, that you get treatment earlier. Because once you come a week or two after the symptoms, then it becomes a bit difficult for our clinicians to be able to assist. Are we planning on adding on the beds that we have? Yes, we are. Right now, we are looking at options of whether we could, as we did during the year, we could take out the quarantine element of the beds to the private facilities. If you would remember, in the mid-year, we had divided, we had categories for our beds. We had beds that were within our own facilities. We had isolation beds within our own facilities, but we also had quarantine beds that we had rented out from the different private establishments like your lodges, hotels, and so forth. So we are working on that. However, having learned from the contractual challenges and agreements that we couldn't necessarily get out of in the middle of the year, we are now doing that cautiously. How can we get into a contract that does not bind us for too long? Because at this point, we are not aware how long this wave is going to take us. Last time, we got into contracts that were binding us for almost 6 months, and negotiating out of that became a bit of a challenge. So we are, yes, looking at adding the number of beds, but that will be dictated too by the number of infections that we are getting, and by the fact that is it necessary for us to get quarantine sites outside of our facilities. Bearing in mind that the quarantine sites that will be outside of facilities will not just be a hotel. There would have to be a few clinicians that are going to be there. There will have to be some nurses that are there so that they look after the patients. So yes, we are working on that, but we will do so incrementally so that we don't end up spending more money than we actually needed. But we've got a proper plan on how we are going to proceed on that. Thank you very much.
Thank you very much. I think there was just one question from Bonga about the economy generally, and whether the statistics that the Premier announced, of what baseline is that, and does that show an adjustment to a new normal, or what does it mean, basically? Look, firstly, I think in the country as a whole, we also have the beneficiaries of the third quarter bounce back, which was very, very significant, much better than expected. I think that sets a good basis for the new year. We'll talk a bit about that just now. Let's just focus a bit on tourism specifically, because that's the season where we are at. And the figures the Premier gave was that 55% in the eThekwini, 80% Ilembe, 80% Ugu, 45% Mgungunylovu, 80 to 100% in Kanyaguda, which is the Shlushluwe, St. Lucia, Sodwana Bay areas. But the most pleasing thing was the 100% figure for the Drakensberg Mountains. And I think the lesson there is that the tourism sector is still very, very viable. We need to have products where people feel safe and not at COVID risk. So I think we certainly, in the eThekwini in particular, it will be a hit to come down to 55%. But hopefully it will be a basis for the industry to survive and build on from there. I think we've got very good organized tourism structures which are very good at marketing, and I think the industry as a whole has shown tremendous resilience in responding to the situation. So we're very, very hopeful. Of course, the tourism sector in particular will depend on how the COVID-19 scenario evolves and with the new variant, but we'd hope very much that by Easter we would be able to regain much of where we were before COVID-19. Perhaps just to comment on the beaches, yes, we support the measures. We were part of the consultation process that the President undertook, and I think it's proved to be correct, together with the kind of messaging people are responding on their own. On the so-called open days like today, I believe the number is not more than 3,000 per popular beach, which is easily managed. And between the South African Police Service and eThekwini Metro in particular, they've devised very, very effective plans for control. Then just perhaps lastly on a broader economic question, as KZN, we've been working on the economic recovery plan for some time, and I think early in the new year, the Premier will be able to launch it, where it will give specific details. We've disaggregated the KZN economy into about 11 to 12 sectors, and a plan for each one with resources. We've prioritized the limited resources to target those which are likely to give us the best return. In conclusion, I think a tribute to our business sector, the small businesses in particular. It's been tough out there. We've been trying to consult on a regular basis and build a strong partnership. In fact, it's a core element of the economic recovery plan is to entrench the social compact between government, business, labor, and civil society. And I think that is taking shape very nicely. Thank you very much.
Doesn't want my chair.
No, thanks. I think the colleagues have covered almost all questions, and we would want, therefore, to just go straight to summarize. Kafishane siyafisa ukubonga kunina nonke ngokuhlala ninathi ukwazi ukuxhumana nomphakathi sidlulisele ulwazi ngesimo se-province in relation to i-pandemic lesibhekene nayo ye-COVID-19. Sifisa ukuzwakalisa amazwi okuzwelana nomndeni wakaZulu koMageba ngokudlula emhlabeni kaMeya waseMlalazi ubaba uJeke Zulu obengomunye wabantu ohlonishwa kakhulu ngomsebenzi wakhe kwi-local government obehlale njalo elangazelela ukuthi abantu basizakale and eveza ulwazi olukhulu nolujulile ngokusebenza kohulumeni basekhaya. Sithi emndenini lehlanga lingehlanga engathi uNkulunkulu anganiqinisa anibophe lawo manqeba. Njengoba ubaba uminister wezempilo ubaba uZweli Mkhize eke washo ngesikhathi ezidlule njengamanje sesingene ntshi kulesi simo la sithi sidila khona ne-second wave ye-COVID-19. Ngalokho siyafisa ukugcizelela sixwayise abantu bakithi ukuthi kubukeka kubanzima kakhulu le second wave ine-impact enkulu. Siyafuna ukugcizelela njengoba sifika nje manje kade sihambela indawo ezihlukahlukene kwaMashu naseMlazi sibheka ama-outlets nama-establishment ahlukahlukene indawo ezidayisayo ney'ndawo zama-rank. Siyafuna ukubonga abantu abaningi abalandela imigudu yokuyiphatha nemigomo ebekiwe ngendlela. Laba abantu abasebenzisa ama-mask bawafake ngendlela ngezikhathi zonke. Uma beye emphakathini ba-observe kumbe balandele lolu hlelo lwe-social distancing okusho ukuthi siqhelelane ngemitha nohafu. Kodwa kusiphatha kabi ukuthi abanye abantu abawasebenzisa bawafaki ngendlela ama-mask, especially labo osukubona ukuthi basohlelweni lokuphuza utshwala noma already baphuzile. Lezo zinto ziyaveza ukuthi khona abantu abangakafinyeleli eku-understanding ngempela ukuthi sibhekene nani. Siyabona futhi kuney'thombe ey'bonakalayo ey'nkundleni zokuxhumana la ubona khona abantu begcwele emabhishi abanye bengawafakile ama-mask bebhukuda emfuleni. Siyafuna ukugcizelela sonke masilandele imigomo njengoba ibekiwe. Siyaqhubeka nokuqinisa isandla kulabo abathengisa uphuzo oludakayo. Amaphoyisa KwaZulu-Natal esebenzisana ne-KZN Liquor Authority azoqinisa ukufundisa abantu ngeindlela zokudayisa ngophuzo nangendlela yokulandela ukuthi uma udayisa abantu bangahlali uma kungeyona i-establishment la kudinga kuhlalwe khona kuphuzwe. But uma futhi abantu bengena bangene befake ama-mask kuzo zonke iy'ndawo ey'dayisayo. Ngalokho-ke siqalile nje sesenze ama-operations angu-44. Kanti kulawo ma-operations ama-license angu-24 asuspendiwe. Awu-13 asacutshungulwa nawo kungase kwenzeke asuspend. So siyafuna ukugcizelela abantu abangayitholi beluza ama-license abayiphilisa ngabo ngobudedengu bokuthi badayise utshwala ngendlela engekho engahambisani nemigomo ebekiwe kulesi sikhathi. Siyafuna futhi ukusho ukuthi izinga lokutheleleka kwabantu liya ngokunyuka. Njengamanje sisesontweni lika-51 of the year 2020. Ngesonto lika-50 ama-numbers abantu ababetheleleke ngalesi sifo kusukela ababetheleleke kuleli sonto lo-50 nje kuphela ayengu-9,857. Kuyisonto la 51 anyuka abangu-10,194. Okusho ukuthi isonto nesonto iy'namba ziyanyuka ziyaphezulu. From u-50 to 51 sibona i-increase ka-4%, okuyinto ethusa kakhulu. Lokhu kuveza ukuthi ama-cases njengamanje aseba ko-2,900 uma enyuke kakhulu. Usuku la singathi in the last 2 weeks ama-numbers abe kumbe i-average iba u-2,165. Lokhu kuyisho ukuthi izinga lokutheleleka kwabantu liphezulu kakhulu. Ama-district affectekile mahlanu, iTheku elina 66%, iLembe lina 5.5 of new cases, uMgungundlovu una 4.2, uGu 9.9 and Herigwala 1.7. Siyafisa ukugcizelela iTheku lisabonakala lihamba phambili ngezinamba zabantu abathelelekayo, okuyinto ebuhlungu ekusazi ukuthi noma kunjalo isizathu ukuthi iTheku likhulu. Kuyasithusa futhi kusiphatha kabi ukuthi inamba zabantu abadlula emhlabeni ngenxa ye-COVID-19 or izifo eyamaniswa ne-COVID-19 nazo ziyenyuka. Abantu abadlule emhlabeni esontweni lika-50 baba ngu-68, kanti ngesonto lika-51 baba ngu-111. Lokho kusitshela ukuthi uma u-analyze nje kahle abantu abashonayo ngenxa yalesi sifo emasontweni amabili adlule kuba abantu abawu-13 ngosuku olulodwa. Lokhu-ke kuyasitshela ukuthi sibhekene nobhubhane olusidinga sonke sibhukule sikwazi ukuzibamba ziqine. Angisho ukuthi enye yezinto esithusayo abantu abashonela emakhaya, inamba yabantu abashonela emakhaya iya ngokunyuka ngoba kusukela lesifo siqalile sesithole inamba ezicela abantu abangu-142 abashonele emakhaya ngenxa yalezi sifo. Siyacela abantu basukume kuse-early baye emtholampilo bakwazi ukulapheka kuse-early. Nabasebenzi bakahulumeni bayaqhubeka ukutheleleka ngalesi sifo and siyabona ukuthi kubalekile ukuthi sibambisane siqinise, kodwa esikubongayo ukuthi iningi labo liyalulama. Ngokunjalo siyafisa ukugcizelela ukuthi izibhedlela zethu zisezingeni, nakuba inamba yabantu abadinga usizo lwezibhedlela inyukile kulesikhashana, kodwa siqinisekisile through umnyango we-Department yakwa-Health ukuthi kuney'nhlelo ey'phelele zokuthi imbhede edila nento ye-COVID-19 ibe khona ey'bhedlela. Ngikhuluma nje i-department ilungise imbhede engaphezu ka-3,000 lapha KwaZulu Natal ukwazi ukuthi sithathe abagulayo abaphethwe lesifo se-COVID-19. Ngiyafisa ukugcizelela ukuthi enye yezinto esiyibonayo uqhamuka kabusha kwama-cluster cases kusiphathe kabi ukubona amasistela awu-6 eshona ngenxa ye-COVID-19 ekade ehlangene ogwini. Kusiphatha kabi ukuthola ukuthi kusenabantu abahlangana babe baningi njengalokho esikubone kwenzeka kwasiza abantu la abantu abangaphezulu ka-2000 bahlangane khona, and lokhu kuveza ukuthi abanye abantu abayithathi serious lesimo esibhekene naso. Sizoqinisa-ke isandla kuzo zonke iy'ndawo. Siyagcizelela ukuthi abantu bakithi uma umuntu esezizwa ukuthi uphathekile aka-quarantine noma aqale ngaleso sikhathi aqhumene nesibhedlela kuse-early. I-Department yakwa-Health under i-leadership kamama uNomagugu Simelane Zulu isine-strategy esibekile. Strategy sokuqala ukubheka le-second wave. I-strategy sesibili ukwazi ukumaneja lesi simo se-festive season. Kule strategy into esibheke kakhulu kuyo ukuthi siqinise i-screening and testing kuwo wonke ama-hotspots. Mese siyabuya siqinisa ukusebenza kwama-call centers akuma-district amonitor abantu ukuthi baphila kanjani labo asebethestwe positive. Siphinde futhi siqinisa ama-teams ethu enza i-tracing kuma-district. Ngasemnothweni kuyacaca ukuthi i-COVID-19 izoba ne-impact enkulu. Silindele ukwehla ngo-62% kwi-tourism isikakhulukazi. Kodwa noma kunjalo asibonga ukuthi i-rate yamanje ikhombisa ukuthi kuyoze kushaye uJanuary izinto zingezimbi kakhulu. eThekwini i-occupancy rate it's around 55%, iba between 70-55% kuye ngokuthi isikhathi siphi. eLembe i-occupancy rate yabo i-80%, ugu it's at 80%, uMgungundlovu imove between 45 and 50%, uMkhanyakude is 100%, and iZululand 45%, amajuba 45 to 50%, iDrakensberg 100%. So kuyakhombisa ukuthi la siney'ndawo ezimumatha kakhulu abantu ngokwe-tourism, i-occupancy rate ikahle, especially uma uzobheka ukuthi eMkhanyakude ila kunama-establishment amaningi akhele isimangaliso Wakeland, kanti iDrakensberg nayo i-heritage site. So these two are at 100% fully booked. Now siyafuna ukugcizelela njengohulumeni waKwaZulu Natal siyayisupporta imigomo ebekwe ngupresident ukuqinisekisa ukuthi sizama ukwehlisa ukusabalala kwalesi sifo. Umnyango oholwa uMEC Pillay waka-Economic Development, Tourism and Environmental Affairs ngokusebenzisana namanye ama-department afana no-Labour namaphoyisa bayaqhubeka benza ama-inspections ey'ndaweni ey'hlukahlukene ey'fana nama-supermarket, ama-factories, iy'ndawo ey'ngama-gym nama-banks. Bazoqhuba lokhu nangesikhathi se-festive, and siyafuna ukugcizelela kubaphathi bey'nkampani nabantu abadayisayo ey'tolo ukuthi asiqinisekise ukuthi i-environment esetshenzwa kuyo iphephile. Ikhathi nesikhathi siqinisekise ukuthi kuyaklinwa, kudisinfectwe ngendlela, and bonke abantu bathi benama-mask, kusetshenzwe ngendlela ehlonipha i-social distancing. Isikhathi nesikhathi abasebenzi bakwazi ukusanitize. Siyaphinda sithi sicela ukubambisana nazo zonke inhlaka zomphakathi, isikakhulukazi abaholi bezenkolo nabaholi bomdabu, omeya namakhansela nabo bonke abaholi emphakathini. Sonke masidlale indima yethu. Ngiyafisa ukugcizelela ukuthi imbono ethi ngeke i-COVID-19 ikuphathe ngenxa yenkolelo ethize, leyo mbono ayilona iqiniso, and siyafisa ukuthi abantu bakithi bangaphili esimeni se-denial. Asibe ndawonye si-understand ukuthi sidila nokhuvethe oluyingozi kubo bonke abantu. Kukumina nawe uma si-acta responsible sizokwazi ukuvimba ukusabalala kwalesi sifo. Siyabonga.
You to colleagues from the media. We adjourn here for today, but maybe I just need to brief the colleagues from the media that tomorrow there is an engagement with religious leaders. We will share more details between the provincial government and religious leaders, and that on the 24th, there will be a commemoration of the Washoba Shobane massacre as we're transitioning to democracy. There is that fateful incident where it's called sometimes the Christmas massacre that will be commemorated. So we invite you all. We'll be sharing more details. Thank you very much to the leadership and thank you to all.